Welcome to Prep and Play, where we have conversations about safer sexual pleasure. This podcast is dedicated to empowering listeners through open, honest discussions surrounding keeping our minds, bodies, and spirits healthy while being sexually active. My name is Danielle, and I'm the Rural Outreach Specialist at AIDS Alabama South, and today I have with me...
My name is Rachel Carter, and I am the nurse practitioner and the director of clinic services at Shell Health Clinic.
And today we're going to start our birth control conversation. On this episode specifically, we'll be focusing on non-hormonal birth control. So that's birth control without hormones. So we're going to go over some different types of non-hormonal birth control, their efficacy, how easy they are to use, and any possible side effects you might experience with this. And so I think this topic is super important because there are a lot of people who don't want to add hormones into their body, but still want to prevent pregnancy. So it's super important to understand these differences so you can understand what might work for you. So the first one we have here is going to be the copper IUD. I know an IUD is like a little device that's inserted into the uterus. It stands for intrauterine device. Can you explain what the copper IUD is and how that works?
Yes, so a copper IUD is actually very popular because it is non-hormonal and it's used a lot in younger teen females for that reason. But what it is a very small T-shaped device that is put up in through the cervix. And what that does is it convinces the body that it's pregnant. So that's how it works, so that you don't get pregnant.
I have so many questions. I don't know if I should ask any of them. How does it convince the body that it's pregnant?
You know, I'm not really sure. It's just the way that it's put in there and it's placed, and it's just like, that's just how it is.
Yeah, so the copper IUD is super cool because it's really effective. It's over 99% effective in preventing pregnancy. And not a lot of non-hormonal birth control methods have that level of efficacy. So how easy do you think it is to use an IUD, a copper IUD specifically?
Extremely easy. I mean, if you can get through the placement of the IUD, there's really no thinking after that, which is why it's so great. You can't forget to take something every single day, and it works very well without you having to do anything different.
We love a prevention method with no user error.
Yes.
So what would be some possible side effects that somebody might experience if they choose the copper IUD?
The most common side effect for that is going to be heavier menstrual periods. So that can become a concern because a lot of times females decide to get on a birth control to help with heavy menstruation. So that can be an annoyance. But again, if you're looking at risks and benefits when coming from somebody, a female, like if you're going to have heavy periods or going to have a baby, I think that you should probably pick that heavier period.
Periods are a lot less expensive than babies. All right. And then the next thing I want to talk about is barrier methods. And there are several different types of barrier methods. We have external condoms, which are typically the condoms you think of, internal condoms, diaphragms, cervical caps, sponges, and spermicide. So, what is an external condom, Rachel?
An external condom is going to be the condom that is placed on the penis before intercourse.
So yeah, just like what we think of when we say condom. How effective are condoms? This is going to shock some people.
They're about 85% effective when used appropriately.
And when we say when used appropriately, there's variations in use, right? So you have perfect use using the condom as it is intended based on the instructions that nobody reads and people with penises do not seem to know. And then you have typical use, which is how most people use it.
Yes.
And so it's about 85% effective. 85 that's a B.
Yeah.
I would say, though, condoms are super easy to use because they're readily available, they're easy to use, and most people at least think they know how to use them.
Yeah.
What are some side effects that somebody could experience with condoms?
Usually the most common is going to be an allergic reaction or some type of just reaction to, especially if it's latex. So if you have any type of an allergy or sensitivity to a latex, you're going to probably have a reaction when using the condoms.
You mentioned if it's latex. What are some other options if somebody is allergic to latex?
Yes, there are latex-free condoms, and we try to have those readily available here with the regular latex condoms also.
Awesome. The next one we have up is an internal condom. Can you explain what an internal condom is and how they work?
So an internal condom is used most commonly inside the vagina. It can also be placed inside the rectum. That's how it's used. It's placed before intercourse starts and then wrapped around the outside of the area as well. Because again, what we want to remember with condoms or any barrier method is the term barrier method. So it's supposed to cover the area that's being protected.
Internal condoms are interesting because they usually have a ring that's more dense than the rest of the condom, and that ring is kind of pinched to be inserted inside of the vagina or anus, and then when you let that go, it'll still hang outside of the orifice that it's inserted in. Is orifice the right word there?
Yeah.
How effective are internal condoms?
79% effective when used appropriately.
I did just explain how internal condoms work, and while they are slightly less effective than external condoms, they're also a little bit less available. Like most drugstores have condoms. We have free condoms here, free external condoms, but internal condoms are a little bit harder to find, harder to access, and they take a lot more care to insert to use properly before sex. The side effects are just going to be similar to external condoms in that they may cause irritation or latex allergies.
Yes, and you do not want to combine the use of an external and internal condom.
Yeah, latex on latex is not good. It will just rip. Next up, we have a diaphragm, which to my understanding is a dome-shaped device that's inserted inside of the vagina to cover the cervix. How effective are diaphragms?
Better than the external and internal, honestly, because it's specifically shaped and sized for the female that is putting it in and used. They're just not as commonly used anymore.
And how would somebody go about getting a diaphragm if they wanted to?
That would be an appointment with their OBGYN.
Awesome. So it's a little less accessible there, although it is slightly more effective. What are some side effects that somebody could experience while using a diaphragm method?
There shouldn't really be any besides the fact that you have to stop what you're doing and go put it in. So it is, again, it's an annoyance, but they do tend to work. And you can place it, prior to the sexual encounter, just not much prior. Like you're not going to put your diaphragm in, then go to the bar, and then come home and hope that it's still there. Because it's going to move around. With anything, when you are putting it into the vagina, you can cause irritation. You're going to open yourself up for some urinary tract infections, sometimes more susceptible to yeast infections, and bacterial vaginosis is probably the most common.
And a little note about diaphragms is that they do need to be used in combination with spermicide.
Yes.
Why is that?
Because spermicide is going to be attacking the sperm before it gets by. They're very tiny. So even though the diaphragm is going to be blocking majority of the semen and the fluid that's coming up there, those sperm are still itty bitty. And when that diaphragm's moved, if there was any that was on the edges or sides and stays in the vagina, they're still lively and swimming. So we want to get them. Like Pac-Man. In my head, that's all I saw when I was talking about them swimming was the little pew pew.
I love that. Okay, and another one here, we have a cervical cap. To be honest, I don't know that I've ever heard of a cervical cap before reading this outline. What is a cervical cap, Rachel?
It's just a very small version of that diaphragm. That it's very similar, but very small. It looks like, did you ever see those little toys that you would play with that you would like flip inside out and set on the table and then it would pop and open back up?
Yes.
That's what it looks like.
How effective is a cervical cap?
Oh, I'd say probably around 75% effective when used appropriately. But again, they're not very common anymore.
And so it does also require fitting by a healthcare provider and use with a spermicide the way diaphragms do. I wonder why these have fallen out of popularity. So it is similar to the diaphragm and also having risk of irritation or infection when just putting something up your vagina. Next, we have a sponge method. Can you explain what a sponge for birth control is?
So a sponge is, I mean, if you think about a sponge, it's exactly what it is. And what it's used for is to absorb the fluid, the semen, as it's coming through there to stop it from getting by. I mean, the way that this one works too is it's going to irritate that lining of the vagina when it is placed into that area. And then you want to use a lot of spermicide so that you're killing before it gets up to the sponge area. And then anything that is still alive and still coming through, you're blocking it with that sponge.
Like Pac-Man.
Yes.
How effective are sponges?
I think they're around 75% also.
Sponges are a little bit easier to use in that you can get those over the counter. You don't have to see a healthcare provider for that.
They are, I guess they're easier to get, but they're not going to be as effective because they're not fitted. So a sponge may be too small for the female that's using it, and in that case it's going to move around a lot more and not block the area that it's supposed to be blocking.
And again, like the diaphragm and cervical caps, it could also cause irritation. And like you were saying, the size, it can be less effective in women who've given birth because there's more space in there.
Especially multiple births, yeah.
Okay. Yeah. We've talked a lot about spermicide in these last few methods here. Can you explain to me what a spermicide is?
So a spermicide is a chemical agent that kills sperm. So it can be used alone or in combination with one of those barrier methods. Generally, when you're buying condoms, especially the external condoms, they come with spermicide. But when we're talking about anything like the diaphragm, the cervical cap, the sponge, you're going to be adding the spermicide to those to make them more effective.
So it's like lube that's toxic to sperm?
Yes.
Loved that.
Yeah.
So how effective is spermicide on its own?
About 72%.
And so, as Rachel mentioned, spermicide you can just get in a store. So it is available over the counter and it can be applied before intercourse. How does one apply spermicide?
I mean, you just place it wherever it needs to be. That's why generally it's used with the barrier method, because you're actually putting it on that device and inserting it.
That makes a lot of sense. And what are some possible side effects that somebody could experience from spermicide?
Similar to just any of the barrier methods, it's going to be any type of irritation, any allergic reaction, higher risk of urinary tract infections as well.
And so that was barrier methods. We also have fertility awareness methods. So fertility awareness is just the concept of being aware when a woman is fertile. There are different points within the menstrual cycle, and at some of those points, a woman is much more likely to get pregnant. There's different ways of doing it. You can track menstrual cycles, the basal body temperature, because as I understand it, a body temperature raises when someone is ovulating. And then the thickness of cervical mucus increases as well during ovulation.
Yes.
So how effective are fertility awareness methods?
It can be up to 88%, but the thing is, it's tricky. Like, I applaud any female that is able to sit there and know their body well enough to do this type of an awareness, because I barely know what day it is of the week. So this would definitely not be a method for me. I do know it is extremely popular and common when females are attempting to get pregnant, just because tracking everything like this is going to give them, you know your body very well when you start doing this and you do this for a long period of time. But trying to do it just as a birth control method, it does take time to really get to know and see what your cycle looks like and be aware of all of that. Lots of practice.
So it requires consistent and careful tracking. And one of the downsides is that for a woman who has like an irregular menstrual cycle, it's not going to operate exactly on a 28-day frame. So she's going to need to know how long her cycle is and at what point during that she ovulates.
Yes. And then if that female is taking any type of like medications, prescription meds, antibiotics, anything like that, that can also throw off the regular menstrual cycle that they were used to. So those are things that you want to keep in mind too.
There are plenty of helpful apps for women using the calendar-based method, or even I think there's devices to do the basal body temperature method at home.
There are.
So there's the one upside of the fertility awareness method is that there are no physical side effects to this.
Right.
It's not going to irritate you. It's not going to cause any infection, but it does require dedication and accuracy. And it's, again, less effective for those with irregular cycles. So we've given you a lot of information today, and there are a lot of factors to consider when choosing the right option for you if you are going with a non-hormonal method. Some factors to consider are going to include your lifestyle and your preferences, like how different methods fit into your lifestyle. As Rachel was saying, I barely know what day it is. I am not going to be able to track my cycle well enough to do a fertility awareness method. I'm just not. For people who are having sex very last minute or don't want to stop the process, things like diaphragms and cervical caps that need to be inserted are going to be a lot less effective as well and a lot less desirable. Health and medical history also play a factor because, as Rachel was talking about, with a lot of the internal barrier methods, like the sponge, the cervical cap, the diaphragm, whether or not a woman has had kids can depend on how effective and well-fitting those devices are. And then also considering long-term versus short-term goals, whether you're looking for like something just this 1 or 2 encounters, or whether you want something that will protect you for years the way like a copper IUD would. It's super important to discuss these options with your healthcare provider so that you can find the right fit. So we talked to you a little bit today about different types of non-hormonal birth control, including the copper IUD, several barrier methods, and a couple fertility awareness methods. Again, I just want to emphasize the importance of selecting a method that aligns with your personal health and lifestyle, because these are only effective when you're able to stick to them and do them consistently.
Yeah, and I would like to also add in have a backup method. Because if you are already planning to use your diaphragm or your sponge, whatever you might have at home, maybe you're not going to be at home, or, there might be an issue where maybe it falls on the floor. Anything can happen. So it's like always have a backup method, which usually I just recommend those external condoms as having something easy, able to grab at whenever time you might need it, just in case something happens.
And for more information and resources about birth control, you can, of course, talk to your healthcare provider or contact your local health department. And on our next episode, Rachel and I will be discussing hormonal birth control methods. So if you'd like to hear about those, tune in a couple weeks. Thank you, Rachel. Thanks, listeners. Bye-bye.